Yes, you can start now. You can start.
Hello.
Hello.
Am I speaking to Mrs. Fatima?
Yes, doctor.
Hello.
Yes, doctor.
Am I speaking to Mrs. Fatma?
Yes, doctor.
37 years old?
Yes, doctor.
Okay. Mrs. Fatma, I am Dr. Kuratulan Shahid, one of the doctors in the clinic. Will be talking about your medical health condition and will be noting down some notes and will be examining you. That will remain confidential. Would that be okay for you?
Okay, doctor.
Okay. So from your notes, I came across that you have been suffering from joint pains. May I know more about it?
Yes, doctor. Thank you so much. Actually, doctor, I'm having these joint pains for last 2 to 3 months now, and I'm feeling myself very fatigued. And initially, I was thinking that it is due to my overwork at home because I have 2 kids, so I'm looking after them. And but now it seems that it involving the other joints also. Now, sometimes it's very difficult for me to get up from my seated position because of my knee joint pains, and my ankles are always almost swollen now.
Uh, Mrs. Fatma, so sorry to hear about it. We'll try to sort it out and we'll address your concerns. Would that be okay?
Okay, thank you, doctor.
Can you tell me, before coming to your illness, any long-term medical illness I should be aware of you have been suffering from?
No, doctor.
Okay, all right. Can you please show me which joint is involved more?
Uh, Doctor, actually, my hands are involved, and both knee joints are my involved, and also my ankles are involved.
At which part of your hand, small joints or wrist joints, which can you please show that to me?
Small joints and wrist also.
All right. And you told me that since 3 months you have been suffering from.
Yes.
Okay. And is it associated with any morning stiffness?
No, doctor.
No morning stiffness?
No morning sickness, doctor.
Okay. So it is started gradually or suddenly?
It is gradual, doctor.
Gradually in onset. Is it progressing or remain same?
No, it's progressing day by day. Initially it was only hand, but now knee joints and also my ankle joints.
All right. So can you please tell me anything which you have noticed that aggravating it?
No, I didn't notice anything.
Anything which is relieving it?
Sometimes if I'm taking some paracetamol or any NSAIDs, it might help me, but otherwise no.
All right. Okay. And at what time you feel more pain in your joints?
All the time, doctor, almost.
On rest. And when you starts working, it gets better?
No.
Okay. All right. And if I say that to grade your pain, that 1 means there is no pain and 10 means there is sharp pain, unbearable pain, how much point you will going to give that?
It's about a 5, 6, not more.
Okay. All right. So, is there any fever associated with it?
No, doctor.
Okay. Any fatigueness?
Fatigue is there. Yes, you're right, doctor.
All right. And what about your mood?
Mood is fine, but nowadays too much thinking about that. What's going on with me? And the concerning part of this, my health is that I'm having this rash also, this nasty rash, and this is increasing day by day. Initially, I was thinking it's a mild thing, it was go away, but now I'm secreting all over my night, all the night my legs, and I got these kind of rashes now.
Can you please show these rashes to me?
Yes, can you see? The right side, initially, my legs were like this. there is having some few spots, but nowadays these are getting more red, and it's involving to my thighs also, you know.
Okay, okay, all right. Are you on any mood medications?
No,
All right. How about your appetite?
appetite has been decreased, doctor. I'm not taking too much food now. I want to eat, but you know,
Okay. So, what about your weight changes?
weight is same.
Weight is same. Okay. Any lumps or bumps in any part of your body?
No,
Okay. Any weather preferences?
no.
Okay. All right. You told me that you have pigmentations or spots in the lower part of your legs. Is it right? So, can
Yes,
you please tell me, is it itchy?
yes. Sometimes I'm scratching my legs, and
All right. And how about it? Does it bleed?
sometimes yes, doctor. You're right.
Okay. Any pain in it?
No,
Have you ever noticed crusting?
yes,
All right. Okay. Are you on any long-term medications?
no, doctor.
All right. So, how much functionally hampered this condition?
Doctor, I told you that I'm looking after my two kids. So initially, I was able to perform my daily task, but now it seems very difficult for me to do the daily tasks. And the whole night, I'm unable to sleep because of this pain and to scratch my legs. And I'm not able actually to
Okay.
do the daily tasks.
All right. I'm so sorry to hear about it. Can you please tell me, has anyone told you that you are getting more pallor than before?
Not bare actually. I'm feeling that my waterworks color has been changed and my eyes are getting yellowish. I don't know why.
All right. Do you have any abdominal pain, tummy pain associated with it?
Yes, I'm feeling nowadays sometimes bloating and tummy pain after especially eating. Can you look at my eyes? My eyes getting like this.
Okay. All right. Okay. So, uh, you, this yellowishness, at what time you notice this yellowishness in your eyes?
It's almost 10 days now.
10 days. Okay. Do you have any throw-ups?
No, I feel sick.
Okay. Any problem in your bowel works?
No.
All right. You told me there is some color change in your waterworks. Any change in your waterworks except this color?
Sometimes frothiness is there.
Sometimes frothiness is there. Okay. All right. Any stone?
No.
All right. Have you noticed that there is? Have you noticed any swelling in your feet associated with it?
Yes, you're right, doctor. Nowadays, I feel that when I'm standing for a long time, my feet become swollen a little bit. Yes, you're right.
All right. All right. So, do you have any problem with the racing or pacing of your heart?
No,
Any shortness of breath?
no,
Any chest pain?
no chest pain, doctor. But
Any
tummy pain
headache?
is there sometimes, I feel tummy pain sometimes.
Can you please touch me at which part of your tummy is hurting?
All over the tummy, doctor.
All over the tummy. So, do you have any headache?
No,
Any weakness in any part of your body?
no,
Any vision issue?
no.
All right. So, okay. Do you have any positive family history regarding this condition or any other condition running in your family?
No, doctor.
Okay. Have you ever been through any surgical procedure?
No.
Okay. Would you mind if I ask some questions from you, personal questions?
Sure, doctor, please.
Okay. Are you pregnant by any chance now?
No, no pregnancy.
Okay. How about your periods?
Periods are fine, doctor.
Okay. And do you consume any pills, birth
No,
controls pill? Okay. So, what do you do for your living?
I'm a housewife, doctor.
Okay. And do you smoke?
No,
Do you drink?
no,
Okay. And do you drive?
no, doctor.
All right. And before development of these conditions, have you traveled any part of the any other part out of the city or area
No,
which
no.
in which you're in? Okay. Okay. May I examine you if you don't mind?
Yes, doctor, sure.
All right. Um, from the bedside, I want to see the general look of the
Mhm.
patient.
Mhm.
How's
You
it?
can say, yes, general look is fine, but patient look, depressed because of his illness. What else you want to see, doctor?
All right. I want to see the hands of the patient.
And you can see that patient is having the acral cyanosis.
Acral cyanosis.
Yes,
Okay. And any clubbing?
no clubbing.
Okay. Any petechial rash on any dorsal surface of the hands?
No,
Any wasting?
no,
How about the surface of the palm? Is it pallor?
no, there's no pallor.
What about the joint tenderness?
There's no joint tenderness at the moment. But when
Okay.
you're feeling the
And
patient is feeling a bit pain, a little bit,
okay.
not more.
Okay. All right. What about the pulse
The pulse is regular 100 beats per minute. Good
and
volume pulse.
blood pressure and blood pressure?
Blood pressure is 130 or 70.
One?
30 or 70.
Okay. So now I'll sir, please.
Yes, yes, yes. Please.
Okay. Is there any pallor in the conjunctiva?
No pallor, but patient is jaundiced.
Patient is jaundice. All right. Any telangiectasias or rash on the face?
Patient, you can see that patient is having mild facial rash.
Mild facial rash. Okay. And how
Yes.
about the oral cavity?
Overcoat is fine.
Oral cavity. And what about the tongue?
Tongue is fine. There is cyanosis below the tongue.
Okay. All right. And now I'll going to examine the abdomen of the patient. So,
Okay.
is there any tenderness?
No,
Any scar mark?
no,
Okay. Any distension?
no distension.
All right. Any visceromegaly?
Spleen is there, 1 to 2 centimeter left, just below the left costal margin.
Okay. And all right. And what about the shifting dullness?
No shifting dullness.
No shifting dullness. What about the kidneys?
Kidneys are normal.
Kidneys are normal. Okay. And gut sounds?
Bowel sounds are good.
Okay. And inguinal lymph nodes?
No lymphadenopathy.
Okay. And what about the pedal edema?
Pedal edema is there. Yes, mild pedal edema
Okay.
is there.
And now I'm inspecting the rash. Okay. So is
Okay.
there any pain in the rash?
No,
All right. Any oozing or anything like that?
no.
Is it raised?
Yes.
All right. Okay. Now I'll ask the patient to sit and now I will see for the cervical lymph nodes. Is there any lymphadenopathy?
No,
Any axillary lymphadenopathy?
no.
All right. I still like to see the basis of the lungs. Is it okay?
Lungs are clear to auscultation.
And what about the buttocks, back area, the sacral area? Is there any rash there?
Uh, Rash is there. Yes, you're right. These is
All
some
right.
itchy and the patient's feeling,
All right.
burning sensation sometimes.
Okay. Now I'm covering the patient.
Okay.
Thank you so much for letting me examine you. Can you please, do you have any concern?
Yes, doctor. I'm very concerned about my health. What's going on with me?
Yes, Mrs. Fatma, I appreciate the concerns you have regarding your health. Actually, you are suffering from a condition which is known as Henoch's colon purpura or IG vasculitis. Don't bother about the medical condition. It's about the defense system which works against your blood channels of your body and leads to
Okay.
the soreness of your blood channels. Are you getting my
Okay.
point?
Yes, doctor. I'm getting your point, but is it a
So
curable condition, doctor?
it is not sometimes it is curable, sometimes it gets resolved by itself, and sometimes some medications of like steroids are required to provide relief to the patient. Are you getting my point?
Yes, doctor, I'm getting your point, but can you tell me why I'm having this yellow my eyes and I am frothy urine? What's going on with me? And why
Actually,
my legs were like this in the past? You can see in
okay,
the
I appreciate the concerns you have. Actually, you have been suffering from this condition, and this is a autoimmune condition which affects the blood channels and other parts of your body as well. So it is also leading to the breakdown of your RBCs, as well as it is causing some soreness in your liver, and it is also leading to some soreness in your kidney. So the functioning capacity of your kidney is hampering. Are you getting my point?
yes, doctor, I'm getting your point. Okay. So what you
Uh,
are going to do now with me?
so we'll going to involve the uh, gut doctor. We're going to involve the um, joint doctors to help you
Okay.
out to get out of this condition. We'll provide you some social support, some nutritional support, some dietitial support, and some psychotherapy support, and some physiotherapy support, and
Okay.
provide with and guide you properly regarding medication. Would that be okay for you?
That's sounds wonderful, but doctor, will I get better? Will I continue to live a normal life like as in the past?
uh, it is very early to say anything. We'll come back to you with certain investigation we're going to run, and then we'll let you know the complete condition about your body. Okay?
Okay. Okay, doctor. Thank you, doctor.
Thank
Thank
you.
you. Thank you. So, Dr. Kurat, you can summarize your case and you have 60 seconds to present this your findings.
Okay. So, thanks for giving me letting me take the history of the patient. My patient is 37 years old, a young lady. She presented with joint pains, which is about for 3 months, and it involves all over the joints of her body. It is progressive in nature. It also led to it has got the functional inability of this patient, and the patient has associated with it some frothiness of the urine and abdominal pain. On examination, patient has mild jaundice, and there is mild abdominal pain, tenderness, and there is pedal edema and rash over the lower part of the body.
And there is also cyanosis what patient was giving you.
Yes, yes. Oh, yeah. I'm sorry. Acral cyanosis was also there.
Okay. So, what's your differential diagnosis, doctor? Now?
So my topmost differential is vasculitis, basically,
Hmm.
and the appearance shows that it could be nodus colon purpura, which is IgA vasculitis. And
Okay.
secondly, I would like to keep the systemic lupus erythematosus, sometimes which also present like this,
Hmm.
and uh, ITP.
ITP. Okay. What else? If the patient having jaundice, cyanosis, and joint pains, and this kind of rash, what else come up in your
And I
mind?
would like to keep leptospirosis.
Okay. Okay. Is there anything else?
And only one thing which is coming in my mind, which is hemolytic anemia associated with all these conditions.
Okay. What else?
Mm, I
Joint
think I
pain,
did.
jaundice through the urine, pedal edema, abdominal pain, and this kind
And
of rash.
polyarthritis nodosa.
Pan. Okay. Wonderful. Okay. So, how you will investigate this case?
So I will go for the general investigation like complete blood picture. Then I'll go for the ESR, inflammatory marker ESR and CRP. Then we'll go for
Hmm.
the renal function tests, serum electrolytes, urine
Hmm.
complete examination, and we'll go for autoimmune profile, and
Okay.
Also go for ultrasound abdomen.
Mm-hmm.
Then I'll go for mm,
What else?
one thing is missing.
Okay. Would you like to do the biopsy of this rash if there's a
Yes,
inconclusive?
thank you.
And what about the
Yes.
renal system? Do you want to do the renal complete examination, urine
I have
examination,
already told you renal complete examination, urine complete examination, and ultrasound
lead,
abdomen plus KUP.
leading to biopsy if inconclusive, right?
Yes.
For the
Okay.
diagnosis. Okay. Okay. So how you will manage this case, doctor?
I will reassure the patient regarding the condition, diagnosis, treatment, prognosis, and complications of the disease. Then I'll involve the social support. Will involve the psychotherapist. Will involve the dietitian, nutrition, and will also going to involve the gut doctors. Will going to involve some rheumatologists and will provide medications to the patient according to the lab reports. Will give some immunosuppressants to the patient.
Very well done. Very well done. Would you like to add anything in this case?
And will also investigate and treat the associations and complications of the disease.
Okay. Okay. Wonderful. Anything else?
Mm, Please
Okay,
correct
Dr. Kurat.
me.
Okay, Dr. Kurat. Thank you so much, Dr. Kurat. Dr. Kurat, that's a wonderful performance from your side. You did very well according to the patient complaints and the complication. What is missing here? A few things are missing, and we will discuss now by keeping here. Our scheme is there, physical examination and identify physical signs there. So, Dr. Kurat, you did very well. So, your introduction was very impressive. You introduced yourself and you asked the identification of the patient, and then surrogate, you set an agenda that we are here to discuss with you about health condition. Then you gave us sympathy, empathy. Then you asked that you will take the confidential notes that will remain confidential forever. Then you ask about the past medical history and forget to ask about here past drug history. That's very important when you are asking the past medical history. Ask here past drug history also. So patient was presented with the joint pains for last 3 months, and it involves hands and both uh, knee joints and ankle joints. That was progressively increasing, and patient is giving you that patient having some tummy pain on and off, and there is a jaundice there, and he noticed a few through the urine, and also there is a change in color of the urine. So there is a rash initially, which increased now. Initially, it was some only lining and some discoloration of the leg, but involved to the this some kind of the red rash, which is increasing day by day. So you're trying everything. You take the history of OD, para, onset, duration, progression, aggravating, relieving factors, and associated symptoms. So whenever we have associated symptoms, there are few local associated symptoms. What are the associated symptoms of joint pains? Redness, tenderness, and swelling. And you did very well. You asked about that, and then you just missed a few questions more about that. Associated general question of joint pains. What are the joint pains association local general questions? That is a change in color of your fingers in the cold. Okay. So need to screen your these questions first. And then tightening of the skin or thinning of the skin, proximal myopathy. You did ask about that. Then the facial rash, hair fall, mouth ulcer, soreness in your eyes, and for the urine. So these are the few questions. You miss a few questions, but you completed the rest of the questions. Then coming to the past medical history, you ask about the family history. You did ask about the social history and also impact on life and job. That's wonderful. So coming to the examination, you were trying to find your findings you miss one only description in your findings, that was cyanosis. Otherwise, you palpate the rash and you ask about the rashes. You were auscultating your heart and lungs also. Abdomen, you find splenomegaly, and jaundice is there. So this case is actually came in 1.5 years before in the UK, and this was a case of cryoglobulinemia. Okay, so you missed that diagnosis. Your differential diagnosis was good initially, but HSP is not fitting in this age, and the rash is not typical for HSP, and involvement of the abdominal pain and jaundice and from the urine. So differential diagnosis was SLE. Okay, in this case, antiphospholipid syndrome you can put over here. You missed a few questions about the abortions, and PAN was good, your differential diagnosis, and you may put another diagnosis that might be a sarcoidosis. Okay, so these are the few differential diagnoses. And for coming to the uh, investigation plan of investigation of this case, CBC to look and ESR CRP to look for anemia and any ongoing inflammatory process, urine complete examination, urea creatinine, electrolytes, LFTs, and also coming to the specific rheumatoid factor is very important to mention here. Okay, then ANA and complement levels, then viral serology. Okay, then serum viscosity if indicated, and X-ray chest to look for any complication, CT chest, and if needed, then angiography of this case. So biopsy, and you missed a few complications of that neuropathy. It's involving the nerves also, most likely the sensory neuropathy. But otherwise, it was good. So management plan, you did very well. So it's general management and the specific management, general management, patient education, counseling, lifestyle modification, and multidisciplinary team involvement, psychosocial therapy, and the specific treatment, and to according to the cause, and that to involve the multidisciplinary team. So that's a wonderful try from your side, Dr. Kurat. So how can we reach this diagnosis? Did you get any idea now, Dr. Kurat? What were missing in history, and why were you were not thinking about the cryoglobulinemia? Dr. Kurat, are you there? So cryoglobulinemia are almost three types always, and there are type 1, type 2, and type 3. So type 1 is less likely. It's involved the only cutaneous manifestation, and the monoclonal immunoglobulins are there. And type 2 and type 3 are 80% of total cryoglobulinemia. So that contain the RA factor, and IgM is positive. These are polyclonal. Type 2 and type 3, that's especially type 3, is associated with a long-standing and inflammatory process like CLD, lymphoproliferative disorders, and connective tissue disorders like SLE and RA. So if the cryoglobulinemia is presented without any other disease, so we called it as an essential cryoglobulinemia. If it is associated, then it's a secondary. Secondary, we already mentioned that it's related to the lymphoproliferative disorders, autoimmune disorders, and infections like especially HCV, hepatitis C virus. So what happening in this case when patients having cryoglobulinemia? So there is a precipitation of immunoglobulins, which form the antigen antibody complexes, and which deposit in the different part of the body, especially the vessels. So patient is having the vasculitic changes, vascular rash. So when these complexes deposit in other organs like kidney, so kidney involvement is the most frequent involvement in cryo. So it can cause thrombosis if involve the vessels. So hyperviscosity is there because of too much immunoglobulin is precipitating, especially in the low temperature. Prognosis of this patient with the cryoglobulinemia is dependent upon the underlying cause. How to treat this patient? No, acral cyanosis is the related to that cryoglobulinemia. So prognosis depend on the underlying disease. And again, if the patient is presented with the hepatitis C related cryoglobulinemia like this patient, so how we will treat this patient? This patient can be treated by the direct acting antiviral drugs along with the, if the renal involvement is, then rituximab and cyclophosphamide we can use to treat this patient. And prognosis is good with the antiviral drugs, but end of the day, the lifespan is 8 to 10 years after diagnosing and treatment. So this was a case of CRYO, which came a few years, 1.5 years back, I think, in the UK. Regarding this case, do you have any question, Dr. Korat?
Sir, can you please repeat the differential diagnosis you told priorly?
Yes, differential diagnosis you can put in this case, antiphospholipid syndrome. Okay, you can put PAN, polyarteritic nodosum. It's also presented with the abdominal pain and the renal involvement and the joint pains, with along with the rash. So initially, this rash is reticular rash, which can, if the disease is mild, if the disease advanced, then it can involve the vessels and it can present with the rash. So other differential diagnosis you can put in this case, it's a SLE, APS, PAN, microscopic polyangiitis. Sometimes you can put sarcoidosis if there is involvement of the lungs. Basically, cryo can involve any part of your body, and it can lead to sometimes, if you involve the CNS, then patient can present it with the stroke also. If they presented with the eye problem, then then eye problem will be there. Frequent abdominal pain, pleurisy, renal involvement, and what are the criteria of admission in this case? I was interested how you're going to manage with me. So the criteria of admission is if the active disease, which is involving the different organs like CNS, renal system, and the CVS. So you need to admit this patient and you start the initially pulse therapy and steroids and leading to the immunosuppressive therapy. If the patient is presented with the life-threatening condition, then we will go for the plasmapheresis. If the patient is asymptomatic and you find that he's having cryo, no treatment is indicated, so mild disease is responding well to the steroids. If not steroid, then immunosuppressive therapy, other like azathioprine and phenolate mofetil. Okay.
Thank you, sir.
You are most welcome, Dr. Kurat, but your performance was very good. You at the end come up with the diagnosis which is involving all these things, that's IgA nephropathy, but IgA nephropathy is less likely involving the such kind of rash in 3 months. IgA nephropathy, you can think when the patient is having upper respiratory tract infection after 3 to 4 days and there's a sudden onset of renal involvement. Okay, hepatic involvement, uh, can you unmute your mic, doctor, and can you ask the question?
Yes, doctor. I ask, this patient can present it only with the hepatic manifestation?
Yes.
Yes.
Yes. Why? Because these, I told you that cryoglobulinemia is not is presented with the idiopathic. When it's essential, and it's most likely is presented with the other inflammatory conditions, which is a long-standing condition like lymphoproliferative disorder. Hepatitis C virus is strongly associated with the cryoglobulinemia type 2 and 3, especially 3. This is polyclonal, so it involves the liver, and it can cause to the long chronic liver disease. Similarly to other hepatitis C related complications like pulmonary hypertension, cirrhosis of the liver, and splenomegaly and jaundice. No, these are the presenting complaints, and these are the complications of hepatitis C. It is actually strongly related to this kind of vasculitis.
Thank you.
You're welcome, doctor. Is there any question? Yes.
Sir, I was asking
Second.
about central cyanosis because I felt like I heard that when she was checking under the tongue, you said there is cyanosis.
You're right, doctor. Maybe that was a mistake from my side, but it's most likely involving the peripheral part of the body. You're right.
Central cyanosis doesn't occur, no, sir?
No, it's not associated with the central cyanosis, but it can involve it can have a central cyanosis if the patient is having a severe lung disease. With this vasculitis, it can cause any type of organ anywhere. If the patient is presented with the CRYO, then we already mentioned it can lead to the thrombosis of the inside the vascular vessels. So any organ can be involved.
Okay, sir. Thank you.
You are
Sir, can you
welcome,
repeat
doctor.
the investigation?
Investigation, yes. Why investigations are you can ANA, RA factors, complement levels, especially C4 are consumed in this case. Then hepatitis C viral serology, and then serum viscosity and serum electrin protein electrophoresis. You can do chest X-ray and CT chest to exclude the other malignancies, because I told you that it's related to associated with the other malignancies also. Angiography, if the patient having some chest pain, then biopsy the skin and renal biopsy for the final diagnosis of renal involvement. Then EMG, if the patient is having a sensory neuropathy, it can involve the nerves, which can lead to the neuropathy, especially sensory neuropathy is more prominent than the motor neuropathy. And other than these are the baseline investigations, CBC to look for the WBC and acute infections, anemia, ESR, CRP, urine complete analysis. URIS is very important in this case. If the patient is having further urine, this is the single most rapid test you can do, and to check, you can check the involvement of the kidney if the protein is there or any blood is there. So moreover, then urea creatinine, electrolytes, LFTs, and liver function test is very important also in this case, the patient having jaundice. These are the investigations we can do usually.
And treatments are for the mild to moderate case, steroid and antiviral drug in this case, like it is involving the liver and the steroid.
Yes, if the liver involvement is there, but it's almost always associated with hepatitis C, then you will you will treat the hepatitis C. There are different studies are there. Before it was treated with the interferon and some antiviral drugs, but now they are using these direct antiviral drugs also, which we are using nowadays frequently in hepatitis C virus, oral medicine for 3 months or 2 months.
Yes, sir. Thank you, sir.
You're welcome. But one thing
Hello,
we can
doctor.
ask.
I have some
Yes.
question.
Yes.
What if the patient is in serious condition?
Yes. This patient. Yes, this patient is presented with the
Hello?
Yes, this patient is having renal involvement. This is a
If the patient is in serious condition, first we will go for pulse therapy and then later on we will go for the underlying disease treatment, right? This should be the thing. We should go like that.
Yes, doctor.
First, the life saving. Okay.
You're right.
And one thing more, this is a typical case, difficult case. So
Yes.
what if we don't say this typical cryoglobulinemia word in our diagnosis? We just say vasculitis and all this. Actually, cryoglobulinemia comes in vasculitis. So is it fine if we don't say this name, or it may cause some problem? Because this is a difficult case.
You are quite well, doctor. Your concern is so valid, but they're not so harsh and they're not so strict. If you give the clue that Dr. Kurat was trying to give the differential diagnosis of vasculitis, that's more than sufficient. Okay. And I was
because it's now we have discussed it, so we will keep it in mind always. We all who has discussed this case, we will now cryoglobulinemia and vasculitis. But if we don't say this word, hopefully, so it will not going to make us fail right away, because otherwise she did very well.
Yes, doctor, you are quite well. But remember one thing: if you are nearby, your ideas are nearby to that particular diagnosis, then the examiner will pull towards that diagnosis. They are trying; they are giving clue to you.
And like you were giving hint, like jaundice, jaundice.
I gave the clue, few clues.
You were giving hint for jaundice, and yes. And cryoglobulinemia is associated with the jaundice. Okay. Okay, we
Yes,
should think about that.
Yes,
Okay.
PAN is also there. PAN
Yes.
is very strongly associated with the hepatitis B, you know.
Yes. Yes.
So
Exactly.
hepatitis C is
That's
related to
why I
the
said कि if
CRYO.
we
So her
and
diagnosis,
bees with pen and all those things.
yes, her differential diagnosis so acceptable
Okay.
because she was there almost.
Okay. Yes, almost. Okay. Thank you, doctor.
You're welcome, doctor. Any other questions?
And one thing she, just for knowledge, I think she missed the smoking and alcohol. Is it important? Is it important if we miss these my thing in this case, or it can be overcome by other things? This is kind of
You're
little
absolutely.
miss.
If the vasculitis is there, you know very well that the vasculitis is always
Smoking.
yes, smoking is very important
Aggravated
to
by
ask.
smoking.
Yes. And the
As
liver
well as
involvement.
alcoholism.
And the patient is
Okay.
having a jaundice. She was trying to rule out this alcohol related liver injury. So she was trying everything. She put every
Okay, we should follow the scheme so we will not miss it.
Yes, scheme is very important, doctor.
She did very well.
Yes, she followed a scheme and
Okay.
yes. So she followed a scheme. She was fulfilling all the criteria of this case: introduction, agenda, sympathy, empathy. You know, these are the marks. Actually, this is not introduction. These are the marks. You are setting your confidentiality. So it's the mark. Sympathy, empathy. It's your patient welfare. Your you're approaching to patient welfare. Sympathy, empathy. There are a few words you can put in your scheme, and you will be safe. You will be in safe zone. Then she established very well. She in the starting she asked about the past medical history. That's a wonderful move from Dr. Kurat. You know, I always used to suggest the candidates, please, when you finish this sympathy part, establish your past medical history and past drug history here. You will save you a lot of time in your exam. Why? Because PACES loves to play with the candidates with the especially drug side effects, drug interactions, and past medical histories. In the clinical exam, always there is always hidden agenda of comorbid condition or any drug related some issues are there. There is no straightforward case in PACES exam. You need to link one symptom which are given to you to the on the background of any any chronic disease. So always try to identify these 2-3 points in the starting. Then OD para. Don't forget to ask about the associated local questions. Associated local questions. She was asking about the joint pain, rheumatology. What are the questions? Pain, swelling, tenderness, any morning stiffness there, or any sounds from the joints. And she was screening all rheumatological questions, but she forgot to ask a few questions: systemic sclerosis in Raynaud and tightening of the skin. Otherwise, she was good. Then coming to the, when you finish your OD para, come to the general questions. That weight changes, anorexia, fever, fatigue, itching, rash, racing in the heart, sleep, snoring, and sweating more than usual. So these are the general questions. Why? Because general questions are very important in the PACES long clinical consultation. If you calculate your whole examination of this PACES, so especially 3 parts are there. In the short cases, they are keeping 4 systems already: CNS, CVS, respiratory, abdomen. 2 systems are remaining behind, that are rheumatology and endocrine. So they love to give these 2 system in the clinical consultation. You can see the past history. You can collect the data of the previous all the examination scenarios. Then you will find almost 80 to 90% of the cases related to these 2 systems. So try to do the long clinical consultation of general symptoms and try to practice more and more these 2 systems. Okay. Rheumatology and endocrinology. These are the most 2, favorite systems in PACES exams. But they have a new trend nowadays. They can give one, emergency case, some chest pain, some dizziness, confusion state, abdominal pain. But most of the time you encounter these two systems. Doctor, did you get your answer?
Oh, yes, doctor. Okay, thank you.
You're welcome, doctor. So admission criteria, Dr. Kurat. So I gave you the admission criteria. If the patient is having active vasculitis, involvement of the renal system, CNS, or any lung involvement, so you will go to admit this case. Otherwise, no need. Okay. Okay. If there is no question left behind, then I'm going to end this meeting. Thank you so much for everyone to joining us, and we will come up with the new diagnosis and new case very soon, inshallah. Thank you so much, doctors. Thank you so
Thank you,
much
friends.
for joining
Thank you.
us. Thank you.